Good afternoon. Thank you for being here with us today. My name is Millie Sweeney. I'm a TA specialist with the National Training and Technical Assistance Center, and I am the Director of Learning and Workforce Development for FREDLA, the Family Run Executive Director Leadership Association. We are here today for our second episode of Words Matter series. So appreciate everyone being here today. Words matter. Words can change the tone, the frame, they can change behavior, they can even change practice. The adage of sticks and stones may break my bones, but words will never hurt me isn't really true. Words can hurt, but they can also heal. Welcome to the Words Matter series, where we engage in open and authentic discussions about the impact of common terminology in children's mental health with those that are directly affected by that terminology. Our goal is to illuminate how the terms we use can influence perception, approach, and practice, as well as explore alternative language or terminology as a means of intentionally shifting how we view and interact with youth, families, and with each other. Today, we'll be exploring the term serious emotional disturbance, or more commonly known as SED. Before we begin, I want to take a moment for you to really consider this term, serious emotional disturbance. What comes to mind when you think of SED, or serious emotional disturbance? Use the link that Joanne's going to put in the chat box to respond to the Menti poll with the thoughts and the perceptions that come to mind when you hear this term. So there will be a link. There you go. Thanks, Joanne. In the chat box where you can go to that website. And as people start putting in, what do you think of? You think of SED, what comes to mind? What images, what words? Thank you. These are going to start to show up as a word cloud. Stress, something's wrong. We're unable. What else? Stress. Okay. So this word cloud shows people's responses to the question, with the most common showing up in the largest font. So what's interesting here is that we don't have any that are coming out more than another. So it seems that we all have a variety of perceptions around this term. Stress is kind of coming out to the forefront. Needing support, managing emotions, dysregulated mood, lonely. Are there other perceptions? I'm going to make sure that we give everybody a chance to log in. So stress is still coming out as the term that's used by more people that are here today. That's interesting. It's not at all what I expected to show up. Wow. Okay. Thank you. Thank you for sharing that. And we'll keep that word cloud. So let's talk about how this term impacts youth and families. We have two parents with us today who not only are caregivers of children and youth and now older adults who have emotional and behavioral challenges, occurring disorders, and they also work with families in a professional capacity. So we have the opportunity here not only about how it impacts them personally, but how it impacts the work that they do with others, their professional feelings about it. So today we have Jane Walker, who is a senior advisor at FREDLA, and Adamina Tankersley, who is the president of the board of directors for Philadelphia Family Voices, and also a TA specialist here at INTAC. So thank you both for being here and being willing to share your experiences and your perspectives. As we start to talk about SED, one of the things that I want to do is explain the definition of it, because we do have two different definitions. I'm going to share my screen just real quickly. Once I can pull it up. 1 second. Yep. There are two definitions of serious emotional disturbance in child serving systems. So one is from SAMHSA, and it is, as you can see here, the presence of a diagnosable mental, behavioral, or emotional disorder that resulted in functional impairment which substantially interferes with or limits the child's role or functioning in family, school, or community activities. It's for those under the age of 18, and it doesn't include developmental, neurodevelopmental disorders, substance-related disorders, or what a therapist may say is other conditions that may be the focus of clinical attention, unless they're co-occurring with another diagnosable SED. In the education system, it's defined in IDEA as a condition exhibiting one or more of the following characteristics over a long period of time and to a marked degree that adversely affects the child's educational performance. So you can kind of see the difference in the focus there. And that includes an inability to learn that cannot be explained by intellectual, sensory, or health factors, an inability to build or maintain satisfactory interpersonal relationships with peers and teachers, inappropriate types of behavior or feelings under normal circumstances, a general pervasive mood of unhappiness or depression, and a tendency to develop physical symptoms or fears associated with personal or school problems. So as defined by IDEA, emotional disturbance includes schizophrenia, but does not apply to children who are socially maladjusted unless it is determined that they have an emotional disturbance. There's actually a lot of terms in there that make me go, ooh, as a parent. So we have two definitions. We have two federal agencies that use the same language, but different definitions and different eligibility criteria. We probably most often see the term SED in the education system, and that's likely because it is the one system that all of our kids go through, and often where their challenges are first seen. And we start hearing about, oh, we might need to get an assessment or something like that. Both definitions, however, are used as eligibility criteria to receive services and supports. So let's talk about this. So Jane and Adamina, and either one of you can start. But from a parent perspective, what does SED mean to you? Adamina, you want to start?
Okay, I can start. For me, on from a parent perspective, when I was told that my son had that diagnosis, it felt very offending. And it felt like he was unusual. And I really didn't understand the diagnoses, because I'm like, okay, well, he has other diagnoses going on. Why do we need to add this one? Because my son, he's living with autism. He also has ADHD, depression and anxiety. And I just didn't understand why we needed to tack that one on as well. And I was told that it would open up the door to other supports for him. But that's not how it felt when that phrase was said to me. And that phrase was stamped on all of his documentation and in his IEP. And that was like the first discussion piece in any types of meetings. It wasn't that we're talking about him as a person, we're talking about this SED diagnosis. So it was very offending, and it felt odd. It didn't feel comfortable. It felt like, well, what are you calling him? Like, what do you think is so bad about the way that he exists? So that's how I felt as a parent, and not even understanding why he was getting that stamp. He already has these other diagnoses. Why do we need to add that one?
So it seemed like a very negative label.
Absolutely. Absolutely.
Mhm. Jane.
Well, I too have a daughter who is now an adult, but as a young child received that label. I'm not calling it's not a diagnosis. I think that's another very, very important differentiation. This is not a diagnosis by any standard. Is it a diagnosis? It is eligibility criteria by 2 federal agencies. The terminology itself is absolutely loaded. Any way you look at it, it is denigrating, it is judgmental, it is disrespectful of our children. I've talked with youth who themselves have been in the room when somebody has then said, oh, okay, well, we're going to code you SED, serious emotionally disturbed, to get services. Well, the youth reacted like it was a sentencing of what does this mean for the rest of their life? And how did that make them feel when they got that label? So apologies as I go on for even using that term. I find it a very disrespectful term, and yet you find it in federal language all over the place. I prefer the term children with mental health needs because I think that really states the reality that they need help, and not that, as Adamita very clearly said, that there's something wrong with them, that they're less than whole, and that anybody caused this, it's a character flaw. And when you have this term being used throughout the country in different state and who are adhering to federal terminology without any training as to the fact that it is not a diagnosis, it is eligibility criteria. You just imagine how that term could be misused as well throughout different agencies throughout the country. So if you will pardon me, Millie, I'm just going to give a little background on that terminology and how it affects our children.
I know you're passionate about the use of this term and how it just is, it's disrespectful, as you said. So please.
But it carries with it, the implications are very, very significant as well. So it is the terminology, but then it is the ramifications of the terminology and the definitions. And they have not been revised for years. So Millie put up the definition of SED. This definition was actually proposed. Any idea when that definition was first coined?
I've seen it. The most recent, I saw something about SAMHSA from 1993. They were discussing some changes to it. I don't know that there's been anything since then.
1960.
Wow.
1960, Eli Bauer coined this term. And then when the first special education law, which was at that time called 94-142, most of you are probably not old enough to know that, but it was before IDA, it was called 94-142, which was in 1975. And they adopted Eli Bauer's language verbatim in the definition for SED. That definition has stayed since 1975. There have been revisions, reauthorizations of the law, and that term has not. Other terms have. We no longer use words such as mentally retarded. The law has changed, that definition, that language has not. So in 1990, there was a large coalition of 30 professional organizations that came together and said, we need to change the language and make it less stigmatizing, and we need to broaden the definition. The definition's way too narrow. We know that more than children need special education support as a result of their education needs. So with this,
This is in the education definition, not.
I'm only talking at the moment about the education definition. Yeah, I'll get to SAMHSA in a minute. But so this coalition of 30 professional organizations were lobbying Congress because this is in federal legislation. It requires federal law to change it. It can't be changed unless there is Congress passes legislation.
I did not know that.
So in there was this strong coalition and it didn't pass. Why do you think it didn't pass? Anybody in the chat box have any idea why it didn't pass?
Yeah, please feel free to chime in. That we have so many people, it's difficult for people to be unmuted, but use the chat box both on Facebook and here on Zoom. Nothing's coming in yet.
Okay, school administrators fought it. They were school boards, superintendents fought it very hard and said that if the language changed, and they were proposing the language to change to, let me find it, emotional or behavioral disorder, EBD. And it was felt that if that terminology was used, it would open the door to having kids come in that actually were not seriously emotion disturbed. I remember I'm from the state of Maryland, and we passed Maryland state legislation to get the terminology changed in education. And we were fought so hard by our local boards of education, the state board of education, the school superintendents association, because of the same reason. We finally were able to get legislation passed on changing the terminology from seriously emotionally disturbed to an emotional disability. That's only in the state of Maryland. Some states have also changed that language, and I would encourage you to check in your own state what is the terminology, but the federal law has seriously emotionally disturbed. So given that that is the language that we currently have and have had since 1975, the data won't surprise you on this at all. So it tells a lot. It's very telling on how this label impacts our children. So if you take the total school population, there is about 13 or 14% of students who are in special education out of the total national school population. So this could vary in your state somewhat, but looking at national data, and there is a National Center for Education Statistics. Encourage you to just browse around and nose around that website, see what you find out. There's another website, we'll share this, where you can actually look at the data from your state. They're required to annually submit data. So we look at this population.
By the way, we can send these links out after Words Matter. There will be a follow-up email so that you'll be able to look for your own state.
So I don't want you to think we're looking at the whole total population. We're only looking at the population of 13 to 14% of students in education. Of that group, about 5% are, and I use the term coded SED. I hate it, forgive me. I don't like it at all, but that's coded SED. So if you look at that and that 5% is somewhat stable, it goes up and down. I'm aware that more and more of our children with mental health needs are actually given 504s instead of
I think
SED. And parents, I think this is the other thing. If you hear Adamina, I don't want my child labeled like that. I did not want my daughter labeled that. There's good reason why you're sitting across the table and somebody says that, well, we can label your child SED and get services. I'm like, why? I don't want her to be labeled that, just like Adamina. So that number or that percentage, about 5%, but many professionals believe the number should be higher, and that our kids, rather than being steered to a 504, they would have more protections if they were in special education, particularly our children with behavioral disorders. But that's another story. We could have another webinar on that. So looking just at this 5% and drilling down, we can see that there are more males. Is that a surprise to anybody? No. There's 6% males and 4.5% females. So fewer females are identified. And again, just looking at that 5% of students who are coded, 6.5% are Black. So overrepresentation of Black, and 5.3 white, and the other Hispanic, Pacific Island are much less. Another very telling piece of the story is that of all students with disabilities in special education, the percentage of students exiting school because of dropout is highest for students who are coded with emotional disturbance. 33%, folks, 33%. Other disability groups are far lower than that. So this term, any way you look at it, is loaded. And what disturbs me, as Millie said, I've been on this bandwagon for several decades, is that nobody is talking about it. Nobody is talking about it. I cannot encourage you enough to start looking within your own state and dig out the data. It's there, it's public, to find out what is going on in your state. So that's just a little bit about the definition in education. If we look at that SAMHSA definition, which is completely different, same language, different definition. That definition is used around block grant funding. So we have a somewhat different way that that definition is used. So in the block grants, anybody who's not familiar with block grants, this is money that comes to every state, directly to the state, to be used to, in their language, intended to support programs and activities for children and adolescents with SED. That's taken directly from the block grant funding. Now, the block grant is also used for adults, it's used for crisis, all kinds of, but in that language is, again, must be used for SED. They have to submit data on the numbers of children using demographics and percentages that would be categorized as SED.
And it is part of the system of care grant as well. That was a comment. And some other federal grant funding.
I was just going to say, statewide family network grants are the purpose of that program is to effectively respond to the needs of children, youth, and young adults with serious emotional disturbance and their families. So it is in many places and used in many different ways. So as I said, the term is loaded. It has ramifications in terms of the ability to access service, in terms of how discretionary it is used. In the state of Maryland, our family organization did a survey or looked at the data and realized that in some jurisdictions in our own state, 0 children were coded ED. In other jurisdictions, there was way overrepresentation of SED. So one has to ask is which is even better, and are either of them accurately using that definition to, and that's in the special education realm, because one jurisdiction that had no children, those children were getting expelled, they had no protections whatsoever. In the other jurisdiction where there was way over representation, they were using that definition to get kids in the door. So I will pause here, but I hope you see this is multi-layered. It is national in scope, but it reaches down and touches our children. It has a direct impact on our children. So if we were to just rephrase or change a terminology, I'd love to change definitions also, but change terminology and said children in need of emotional support, would that not come across to everyone in, oh my gosh, we need to do whatever we can to support this child, as opposed to this child is seriously emotionally disturbed. There's no help for them. What did their parents do or not do to cause this? And I certainly never would have raised my children this way. So the ramifications are many. So I'm pausing. Thank you, Millie. I think I probably went on way too long.
I'm very passionate about this.
Yes.
Yeah, I want to ask both of you, because Adamina, you are the president of the board for a new an up and going family run organization in Philadelphia, and Jane has been a part of starting 2 family runs as well as a mental health center. From that professional perspective, what impacts have you seen on the families and the children that are being served? How is it impacting? And there's a purpose for having a term, like you said, not a diagnosis, it's for eligibility, but I understand that there's a reason behind it, but the terminology is stigmatizing, it's negative, it's labeling, it makes you feel like something's wrong with you. So, from your professional experience, what impact have you seen this have directly on individual children and families?
The term is, it's supposed to be used to have you eligible for other services. However, it is weaponized often. And what I mean by that is children, students, youth are not included in certain activities. Certain schools won't even admit you. That's the professional lens. And I know this on a personal level also, because my son could not attend his neighborhood school. And in 1 year, we had to look at 10 different schools that were specific schools that were made for children with behavioral issues, with any type of emotional issues, autism, all those labels. And we looked at 10 different schools, and only 4 of them would give us an interview because my son had the SED diagnoses. And on a professional level, many parents come to me and tell me, hey, this school won't even look at my son's record. This school won't even let us come to interview because he has this label. So in effect, it's weaponized against many students, because if you're not able to attend your neighborhood school or your public school because of, different things, and the school's not able to support you or to provide the support your student needs, you have to go outside and you have to go to an approved private school that can support your student. But then you're like, wait a minute, I read his record and he has that label. We're not even going to try it. We're not even going to meet the family. We don't want to meet the student. We've read the record. No, they have to go somewhere else. So in effect, it's not giving the supports it's supposed to. It's really in a term
Exclusionary.
excluding children.
Mhm.
It's excluding and making the pool of education and supports much smaller. My son ended up going to a school that was an hour and a half from our home because every school that was closer that he was able to go to that could support him did not want him.
Mhm.
So he was an hour and a half away to get the education and support that he needed because of because of that label.
Mhm.
And it's just really odd. And he is offended when that is used, and he doesn't like to be in that category. You know, he doesn't like to, you know, he was like, I can't wait till I'm grown up and I'm out of school. You know, he's 23 now, but he would say, I can't wait till I'm grown up and out of school and that doesn't have to follow me. And I'm like, wow, like he understood the ramifications of that label following him and really impeding what he needed and who he was as a person. Because as a person, he's not severely emotionally disturbed. As a person, he's a person that needs supports because of trauma. He's a person that needs supports because he needs the supports because of the things that he's gone through and the way that his mind works. And so that doesn't mean that, because I don't see him as emotionally disturbed. I just don't, I don't know what people look like that are emotionally disturbed, but it doesn't look like my son. And I don't see him in that category. So I'm like, it just doesn't sit well with me. It just really doesn't sit well. And I don't have a problem that, you know, he has any of the diagnoses he has. I have no problem with that. But to put him in a category, it's almost like a taboo category to be in.
Yes.
You know, if I'm explaining that well, it's almost like, you know, we're going to stamp you with this and it's going to follow you forever. Because I tried several times to get it removed. It bothered me that much. And on a professional level and a personal level, once it's there, it's there.
Yeah.
Once you're in that category, you're in that category.
I also heard you say there's so many layers to the impacts of that. You know, trying to find a school that fits and that can support your child. The having to drive an hour and a half, doing all the research yourself, and then trying to fight against something that was really bothersome to him as well as to you, you know, and made you feel less than,
Yes.
you know, in some negative category. I mean, it's not just a way to categorize to get services. It is, and he used the term weaponized, and someone in the chat said, you know, how do we address this weaponization of terminology? Changing our words is only a temporary fix. You have to change the lens through which our children are viewed, and that's really true. But sometimes words is where we have to start. You know,
yeah, I agree with that.
Can have, you know, long-term consequences, and you do have to think about that when someone is young, and that it is going to follow them. And it disturbs me that It disturbs me that it was more of an exclusionary thing instead of eligibility. So
absolutely. It's also used on a professional level. I have seen, and parents have shared with me, that their children are transferred out of their neighborhood school to other schools that are more considered behavior schools, you know, and it doesn't have that that emotional support that many students need. And they're now at a behavior school, and behavior schools and schools that are assisting emotionally and educationally, they're very, very different. At least here in Pennsylvania, they're very different. Because when you go to a behavior school, those schools have a high police presence. The doors are locked down. Sometimes children are handcuffed. Like the behavior consequences are very severe. And there's not that support of when the child has an emotional thing going on, we're not emotionally helping to de-escalate. We're just automatically treating you as if you're in prison and this is a school. So that's been a lot of discussion when it comes to Pennsylvania and how behavior schools are, as opposed to a school that is there to help and support educationally and emotionally these children that need a higher level of supports and services.
Mhm.
So, and I can also speak on a personal level. The first school my son was sent to was a behavior school, and it was just an unreal experience. And my son really suffered from that, and we had to do counseling from that. And he only attended about 6 months, but he just couldn't attend that school. It was just so difficult for him to see other students rage at times when they were raging, and other students getting into fights and things, and it really triggered him. And twice straight from school we had to take him to the emergency room from
Mhm.
having a meltdown. And for me, it was like, these children are here almost like in a jail or prison, and that's not the support that they need. That's like an inappropriate place to be placed. And it's almost like that's the first place we're going to place the children that have this SED diagnosis, as opposed to trying to place them somewhere where they can get treatment for their trauma, appropriate supports for their emotional levels, appropriate supports for their education. It's this label and these words have huge ramifications, and it goes towards a more systemic issue. Just the label itself.
There's some assumptions that seem to be attached to it that lead to, that potentially lead to an inappropriate support or inappropriate
Absolutely.
setting,
Absolutely.
because
People
of-
feared my son and didn't even know him.
Yeah, they're definitely, and we saw in the word cloud some of the things that came up, and I'm still interested that the main word was stress, because to me that's like a recognition of what may be going on as opposed to this negative label. So that I found that interesting. So what, and Jane, maybe you can speak to this, having started and operated 3 different organizations focused on supporting youth and families. You know, what are the differences when that term is not used or something else is used? Was there anything that you intentionally did to kind of remove the use of that, or to address the stigma associated with it?
Well, I mean, there's strategy, I would say. Our experience the first year trying to get the label changed was, I would say, fraught with conflict. We were ill prepared that the superintendents and boards of education were kind of come at us, and that is no joke. We had a legislator who had a grandchild and was very supportive, and he was actually, his staff told us later that the head of the board of Association of Superintendents marched in, and there was a screaming match in his office because of the concern about opening the floodgates for these children. So that you have to really strategize. And we did a statewide survey, and we had like 1,500 responses.
Mhm.
We put out a number of different options for people to choose. And that was the one we took forth to the legislature. That is the one that got killed by the following year. The head of special education for the state met with us and said, we are behind you. We want to make this work. How can we bring people together and come up with a language that it will be accepted? So that was one strategy, and that was successful. The terminology was changed from serious emotional disturbed to emotional disability. Is that perfect? Heavens no, but it was better.
Mhm.
There's another aspect to it that really became apparent in that process, and that was the whole identification. And I mentioned the disparity. Maryland is not a large state. We saw huge disparity in how that eligibility criteria was being used. That was the second line of strategy is how do we get more consistent use of the terminology
Mhm.
and definition. And we, again, in partnership with our state Department of Special Education and our family organization, the Maryland Coalition of Families, we work with the state and the Association of School Psychologists to develop a guidelines on identification, and not, which is the typical response you get is, well, their education is fine, they can't be in special education, which is not the case with this particular disability. So there's multiple layers to the strategy and how you can change how the definition is used to improve access to services for kids without stigmatizing them.
Mhm. Yeah, so there definitely are some strategies. And I was just noticing in the chat, some people were sharing how the terminology's changed, like in Alaska, it's
Yes,
extended resource.
right.
So that's something new.
We did a survey of states when we were doing ours, and this was now maybe, I don't know, 10 years ago or so. And we noted that there were quite a significant number of states, I can't remember the exact number,
Mhm.
that had changed that language. They
They
can't change, they cannot change the definition. They
Yeah,
can change the terminology. They can't change the definition.
yeah. Also, I was noticing that there was a survey that was done in 2014. Fred did that one. And one of the things that was noted in there is that, most of those who responded agreed with keeping one of the pieces of this being a DSM diagnosis. But there were two concerns with that, is that the emphasis should still be placed on what the child can do, on ability. So strength-based language is a strategy to use here. Serious emotional disturbance is not a strength-based term.
Yeah.
So that could be a strategy. And also the definition should accommodate children who have not yet been diagnosed.
Yes.
Because not everyone has access
Mhm.
to assessments and diagnostic opportunities, but they're still struggling. So my own child struggled for a while before we got a diagnosis. And there were reasons behind that, but that doesn't mean that they didn't need some type of support for what they were experiencing right then.
Mhm.
So that was something that just kind of jumped out from that. What are terms that could be used? You mentioned something earlier, but for both you and Adamina, what would be a better approach, better terminology that we all, just as individuals in our roles, could use or try a different approach? What would you suggest, both as a parent and as a professional in this field?
Well, again, I really lean toward the terminology that this child needs support. That probably would not fly in terms of federal language. And there is a huge, there's not agreement in the community on language. Even the terminology disability, which was one that was approved in Maryland, but there have been pushbacks in other areas of the country where using the term disability associated with our children was also viewed as stigmatizing. So I think there needs to be a great deal of thought put in this, but my personal approach is one that says if we have to have a label, the label needs to present these children in need of support, and rather than labeling them some disrespectful way.
Mhm.
For me, I would be comfortable if it was, I mean, because it doesn't have to be so complex, this category. or what we're using. And for me, I would be comfortable with eligible for additional supports.
Mhm.
To me, that seems very simple. It sounds clean. It doesn't sound stigmatizing, because for me, severely emotional disturbed just feels
Right.
wrong. It just sounds wrong. It feels wrong. And in need of additional supports or eligible for additional supports, you're it just comes across just completely differently. Completely differently. You know, you're not going to have people that read this over and are thinking danger first. Because when people met my son and actually interviewed with my son for the schools he went to, they were like, wow, I really wish I could have met you before I read your file. Because a file sometimes are records of your worst moments. And just because that moment is there, that doesn't mean that's who you are. And that record of your worst moments is what we present so that you can meet people and have a new experience. But how can I meet and have a new experience if my worst moments is what you see first? And these labels, exactly. And these labels are what's seen first. You haven't even gotten a chance to meet me at my core and who I really am most of the time. Most of the time, I'm not my worst moment. That's one moment in a day. And how often does that occur? So when you see those worst moments, it's like, we let that one go somewhere else. Let that be someone else's problem. As opposed to, how can I support this person? How can I help shape their future? How can I support them when they have these times of needs? How can we change the reaction of the time of need and the meltdown that's occurring? How can we change this crisis experience for this person so that it doesn't get this bad? So that they don't feel it and go through it in this way.
And it doesn't change
the thought.
The rest of their experiences.
Absolutely.
The label can be tainting. It can, you're in the chat, well said, beautifully spoken. And that's true. And what I heard both of you say is we definitely need to change the terminology. We're not gonna be able to change the definition, but maybe we can change what it's called. And that takes some work. It's also your personal approach. It's about not just going by what is written in a file that is often using terminology that has to be in there in order to meet requirements to get support. Just individually, the way that we approach people, taking in mind the whole person and not the one situation. I know when I've been working with juvenile justice, and I always try to remind people, when you see someone coming into court, it is not their best day. They're there for a reason, but that does not define them, just like a diagnosis does not define somebody. So those are all, different strategies that could definitely be used. And also in the chat, feel free to drop in any strategies that you have or other terms that you think might work. I love seeing that there are different terms that are used to still include this eligibility requirements that we need to have for funding and that sort of thing. But I like that they're now said in different ways, which is important. Do either of you have any other suggestions before we go to, I have another Minty poll I wanted to.
Well, as I mentioned earlier, I really encourage people to look in your own states, check what language is being used, and look at the data. In Maryland, we looked at the data and requested a meeting with the director of special education for the state. And we said, the data shows that our kids are dropping out, not graduating. We have the worst graduation rate of any disability. We use the data that they collect and met with them, not in an adversarial way, in a concerned way. How can we work with you? And we ended up with a 2 to 3 year project in partnership with our state Department of Education, in which they actually, helped with the legislation change, helped with and funded the Association of School Psychologists to develop these guidelines and do training, so there was more consistency of identification. And then they put out several $1 million worth of grants to local jurisdictions to develop more services for students with SED, or at risk of. So I think family and family organizations have tremendous ability to get this done.
Mhm.
Get it done.
Especially if our community partners, you know,
Yep.
clinicians and teachers and
Yes.
everyone who works with youth and families in whatever way, if we can just work together on that and collaborate and recognize. I heard what you said about people being afraid the floodgates are going to open, and the need is already there.
Yeah.
This is not, anything new. I know at one point when we were trying to do a screening in schools here in my home state, and that was one of the concerns why they didn't want us to come in and do the screening. But there's so many ways you can connect, and sometimes if you do try, you don't have floodgates. What you have is a better ability to recognize when a student or a child needs something, and you're better able to capture it sooner. You're better able to provide something sooner that may keep it from getting worse. So I think we need to also combat that myth.
Well, and I would also say that there is a tremendous momentum now around school mental health, and there is more funding available to states around school mental health. So we really have to look at this. I mean, this is about words matter, and absolutely that terminology is no help. But if we look at how can we best serve the mental health needs of children, we really have to be looking at the big picture, including school mental health with that. So, Millie.
I know that you're going to need to run. So,
Yeah.
Almina, any last words before we move to the Menti poll? Just want to give you an opportunity.
No, I just want, people just to really think about, the words we use and the way that words are used can really shape an interaction. It can shape the thoughts. It can shape a process. It can shape a system. So we really want to be mindful of the words that are used and how words are used, because we want to make sure that we're thinking about, if we're using a word and we're talking about a group of people, that could be really stigmatizing. And at times for my son, if there was a disagreement at school, or, there was an issue, he was often seen as, you're the problem, because those words are attached to him. Instead of really deep digging down and asking the questions of both parties of, well, what's going on? Why is there a disagreement? Instead of just assuming because he has this label or he's in this category, he's the problem.
Yeah.
So we really want to be mindful of the words that we use, because it really does shape interactions. It shapes thoughts. It shapes processes. It shapes systems. Words really do matter.
They do. Well said. Again, Almina. I know Jane had to go because she's doing a webinar on a topic with early childhood. But I want to thank both you and Jane for sharing your experiences and your expertise with us. Before we go, though, let's think again about those initial perceptions that showed up in the word cloud. What people initially thought when they heard the term serious emotional disturbance. Now I really want you to consider what you've heard from Jane and from Adamina today, as well as what people have shared in the chat box. Consider that, consider learning and different strategies that you might be able to take. And I want you to answer another Menti poll. So there is a link. And the question is, what are some of the things that you're committed to doing within your role to change how this term is used or not used? And so use that link. And then your responses are going to be shared on the screen. Oops, a second. So once you You get connected to the Menti. You go to menti.com and use the code that you can see on the screen. Change, so that I will share this information. Change my words. Model. More and learning more and providing educational experiences. Be more aware. That's the very first step. Oh, I'm committed to speak to child welfare by not pushing this for students to receive services. Might use the term SED. It kind of opens your eyes when you see how it impacts, you know, an individual parent or young person, and how it can follow them, and then the data. Jane is always so good about sharing data. Can you move that up just a little bit, Joanne? I can't see the last one. There we go. Share this information. Yeah, absolutely. It does sometimes just start with words. It's a much bigger issue and it's multi-layered. But if we can just start at the individual level, being aware of what we say and how that impacts people, and try to be more strength-based in what we're saying, it can definitely make a difference. So there's hopefully this is also changing kind of your perception around this issue. So I want to thank you for joining us today. And we really hope that you'll join us next month. We're going to be talking about the term crisis or being in crisis, and we will have a young adult and a parent with us who also is a parent peer support provider on a crisis team. So some personal and professional experience to hear from. And in closing, we really challenge you to be intentional in using terms that are more supportive, that are more respectful of the youth and family experience and their expertise. So thank you again, and please remember that words matter.
Thank you everyone for your time, and have a great day.